Hello everyone, my name is Dr. Adam Abodeely. I am the Chief Medical Officer and co-founder of Reserve MD and the Chief Medical Officer for the Cannabinoid Industry Association. As a board-certified surgeon, I specialize in the medical and surgical treatment of gastrointestinal cancers and other GI ailments. For the past 10 years, I've been working with patients who are interested in incorporating medical cannabis and cannabinoid therapies for a variety of conditions. It has been such a benefit not only for patients, but also for the medical and scientific community as a whole, to witness those who had to once use cannabis illegally, to see them now have legal access to this medication, as has been the case in New York State and several other states. Our improved acceptance for cannabis as a society has improved our ability to understand how cannabis works, and it's this acceptance that has also given us the ability to learn more about ourselves as biological human beings, and will ultimately lead to improvements in our overall health. Throughout history, we have searched for an understanding of why the cannabis sativa plant has been useful for a variety of medical ailments, and why it has also been enjoyed recreationally. The compounds found within the plant are what ultimately led us to the discovery of the endocannabinoid system. The importance of this discovery cannot be understated because the endocannabinoid system plays an important role in maintaining a state of balance within every cell and organ system in our body. Deficiencies in the endocannabinoid system have been associated with particular medical conditions. I often describe the cannabis industry as a collision between science, medicine, agriculture, law, and politics. And now more than ever, we need a clear message about the science and be able to provide accurate education about cannabinoids. Not only will this define its safety and societal impact, but ultimately it is the science that will drive and steer this industry. In order for us to get to where we are today, to a society of increased acceptance, we will need sound research and education. One of the challenges that I see the industry struggling with is that it has been growing at a rate that far exceeds its ability to keep up with the educational requirements to direct safe and appropriate use. For example, when I prescribe a conventional pharmaceutical medication, I know that my patients will have access to highly educated professionals about this medication, either from pharmacists or pharmaceutical patient representatives, who can adequately educate to improve safety and efficacy. These educational support systems drive safety and allow us to develop a set of best practices to maximize efficacy and outcome. Unfortunately, since gaps in the science of cannabinoid-based therapies still exist, there have also been gaps in the educational training in this industry. This has led to a tremendous amount of confusion, misinformation, and false claims, which this industry simply cannot afford if it wants to continue to gain acceptance and prove any health societal benefits. I am proud to be able to contribute to this exciting and evolving industry to help improve our understanding of not only the science of cannabinoids, but also to ensure that the education being provided regarding cannabinoids are accurate and up to date. Arming the entire industry and its consumers with sound education about the science, safety, and clinical applications is going to be required for progression and to avoid being held up by false messaging. For example, we have already seen many instances where false claims have resulted in significant delays in the acceptance of cannabinoid-based therapies, growth of the market, and overall access to patients and consumers. At the CBDIA, our mission is to empower professionals in the cannabinoid industry with education, advocacy, and most importantly, community. Connect with myself and other top cannabinoid experts by clicking on the link below. I encourage you to join our efforts at the CBDIA because together we can achieve more.